members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press. Let me start by apologizing truly for the delayed start of this briefing. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, the 30th of November, 2020. As you are aware, other factors continue to intervene with a scheduled program of briefing on the pandemic. As much as possible, the Presidential Task Force shall minimize such occurrences so as to keep the nation fully abreast of developments. The members of the Presidential Task Force, on a very painful note, wish to express our deepest condolences to the President, the government, and the people of Borno State over the recent massacre of farmers by insurgents. Our hearts and prayers go out to the families of the victims, and we pray that Almighty God shall comfort them. Humanity has been under siege of COVID-19, and we cannot afford to relax our security even as we mount a national response. We therefore urge all citizens to remain vigilant always. The business of safety against COVID-19 and security against insurgents and other forms of criminal activities is the business of everybody. The global number of COVID-19 infections crossed 63 million on Sunday, 29th November 2020. Similarly, the US crossed the 30 million mark and has been recording high daily case incidence of over 130,000 for 2 straight weeks. In Africa, Nigeria ranks 5th for both the highest cumulative cases and deaths. And if you are mindful, to remember that last week when I briefed, I said cumulative we were number 9, and death-wise we were number 8 on the African continent. But very, very sadly, we are 5th now, both cumulative and also death-wise. That's a clear indication that something is happening and that we must take absolute precautions even as we prepare for the festivities. Over the past weeks, discussions have been held about the safety issues pertaining to the National Sports Festival, scheduled to hold in Benin, Edo State. New dates have been agreed upon early in 2021, before which measures will be put in place to minimize infections. We were quite concerned about the figure of athletes that were going to congregate in Benin, about 12,000 within the period of the festivities, with a lot of people returning home from Europe and America. And we felt there was need for absolute caution, more so that the athletes were going to stay in hostile environments. The Honorable Minister of Youth and Sports Development would have been here to brief you and the nation on the preparations, but for other exigencies, he will be here subsequently to give those briefings. We are pleased to inform you that the first stream of NYSC has concluded camping, while we expect the second stream to go to camp on the 3rd of December, and the third stream will be in January of 2021. Necessary measures, building on the successes of the first stream, have been taken. The DG of the Nigerian Center for Disease Control will brief you on this. The Presidential Task Force is escalating its surveillance and testing drive to ensure that the spread of the virus is effectively contained even as we approach the festive season. We shall continue to remind Nigerians that all non-essential trips should be put off this December season. This is for your safety and good health. The national coordinator would expand equally on this. But this morning, as I was watching CNN, I got a little bit worried when I heard the coordinator of the COVID-19 of the White House speak about the Thanksgiving season that has just ended in the US. And when she remarked that if you participated in any of the Thanksgiving activities, consider yourself infected and behave as one that is infected, seek testing immediately and isolate yourself. That, however, would depict our picture as we prepare for the Christmas festivities. And that's why we're encouraging you not to embark on non-essential trips. And as much as possible, try as best as you can to avoid congregating in large gatherings and continuously avail yourself of the non-pharmaceutical interventions, the wearing of masks, the keeping of social distancing, the preservation of hygiene in terms of hand washing, and also the use of sanitizers. That way, we can keep ourselves safe, our families, and our communities. There has been a lot of positive developments around the world regarding vaccines. This is a significant achievement. However, before it becomes available, let's use the vaccine that we have, which is the MPIs. We urge you to continue to comply with the non-pharmaceutical interventions. The Presidential Task Force is already working on the strategy for gaining access to the vaccine as soon as they are available. I now invite the Honorable Minister of Health, followed by the DG, NCDC, and the National Coordinator to update you from the technical perspectives, and thereafter we'll take your questions, and if there are need for further clarification by honorable ministers here or other members of the Presidential Task Force, we would attend to that. I thank you all for listening and have a good evening. Thank you.
Good afternoon, everybody. The chairman of the Presidential Task Force on COVID-19, honorable ministers, national coordinator, director general, permanent secretaries, and ladies and gentlemen. On the 29th of November 2020, 82 new COVID-19 cases were recorded from 11 states, bringing the total number of confirmed cases in Nigeria to 67,412 out of 756,237 persons tested. 63,055 cases have been treated and discharged, and 1,173 deaths have sadly been recorded. We still hope to reduce case fatality by strengthening our capacity to manage cases, but it is only possible if persons test themselves early once they have symptoms or have been in contact with a suspected case, and also if all who test positive present themselves immediately for evaluation by experts who will prescribe your treatment based on that, either at home or in a facility, depending on the severity, vulnerability, need for care, or other criteria. All cases, whether home-based for treatment or institutional, are to be supervised by medical personnel. This is particularly important given the threat to Nigeria posed by the spiraling rate of infection in countries with which Nigeria has strong political, business, social, and family relations. There is correspondingly high volume of travel between Nigeria and these countries, which is what also determines the risk. PTF will continue to review protocols at our points of entry to be responsive to changing scenarios. Under no condition should we be lulled into complacency because, as the Director General of the World Health Organization advises, nobody is safe till we are all safe. I also urge all Nigerians to put off non-essential travel by mass transit, especially international travel, and most especially travel to high-burden countries, except such travel is extremely urgent. Mass travel over the upcoming holiday period is a matter of concern and should be restricted. We urge all to restrict their travel, and also associated social activities should be curtailed. This is a sacrifice we must make to preserve lives. The elderly and persons with delicate health should best remain where they are and not travel or mix in crowds, except they absolutely have protection and must travel. Worship over the holiday should still be with the strictest conditions, and if possible, for those who do it online, to do it like that. The experience from the Thanksgiving celebration in the United States indicates a serious lesson that the COVID spike from travel and socialization went on with the holiday. This should be a warning for us. A major step in upgrading the Ministry of Health's healthcare financing agenda was taken last week when I had the privilege of performing the launch of a program of the National Health Insurance Scheme titled Group, Individual, and Family Social Health Insurance Program. The major objective of it is to rapidly expand the scope of healthcare coverage to Nigerians and also expand the fiscal space for financing health care in our quest to attain universal health coverage and sustainable development goals. The gift ship program offers citizens the opportunity to participate and benefit from health insurance by subscribing to affordable premium payments either alone or with their families, clan, or group. Proxy enrollment of family units or groups of people, even as a philanthropic gesture, is encouraged. I therefore invite well-meaning persons in Nigeria and in the diaspora to strongly consider this very attractive option of serving your loved ones, extended family, community, clan, and members of your constituency or interest group by enrolling them in giftship. This will give them financial access to comprehensive quality health care coverage at the point of need and also at time of need. The Ministry of Health today also launched the revised National Health Promotion Policy of 2019, prepared by the Department of Family Health, that explains our commitment to improving health and well-being of Nigerians by empowering them to adopt healthier lifestyle choices. This is even more relevant at this time of pandemic, where people need to be better informed and be in a better health of state or have better health-seeking behavior as government strives to provide access to quality health care for all persons. Finally, I use this opportunity again to remind all citizens that this pandemic is not over. It is not a time to be complacent. We have a possibility to work with government to defeat the pandemic, and although we are positioning our country for access to COVID vaccines, it may still take a while for countries to access it and for all citizens to get the vaccination. It is more realistic that we adopt preventive measures which have been proven to be successful in controlling pandemics. To observe physical distancing, respiratory hygiene, wear your mask all the time and appropriately, especially in public places. Regularly wash your hands, avoid gathering in crowds, use hand sanitizers to protect yourself, protect your friends, and protect your neighbor. Thank you for your attention.
Secretaries, NC, WR, gentlemen of the press. This will be quite brief. Like you know, we are headed into the month of December, and I want to take a few minutes just to reflect on where we are. When we first received reports of this virus early in January this year, none of us expected it to be as disruptive as it has been to our way of life. From schools to transport, workplaces, government, businesses, jobs, lives, everything literally has been affected in our country. It is why at NCDC we continue to manage this outbreak, but at the same time we are working to learn from the challenges that we faced, looking at new processes, improving the skills of our people, improving our facilities to ensure that we are better prepared for any subsequent outbreak. As the year rounds up, I know that many of us this year did not expect it to pan out this way, but we can take the necessary actions now to make 2021 a hopeful and successful year and bring about a move back to the way of life that we miss so much. But before we get there, we have an intervening period. The month of December, the associated festivities that mark the end of the year, the normal travel that we are used to carrying out. And this is really to re-emphasize the call of both the chair of the PTF and the Honorable Minister of Health, that many of the traditional activities that we engage in at this time of the year, whether it's Christmas carols or festivals, whether it's trips or family gatherings, each single one of those could end up being a super spreader event, each of them. So we must take this into consideration as we make our choices. While we have had a lot of encouraging news about vaccines, we are still very far from mass production. We are even very far from having one with a license. So we have to tighten our belts and get through this month of December. So I really want to encourage everyone listening to this to remain vigilant, to remain disciplined, to stay safe and abide by the general protocols that we have advised throughout the year. This is the best way we can keep our loved ones safe and transition safely into 2021. This is particularly important for the elderly in our society who we may want to go and visit, as we generally do at this time of the year. There will be many more opportunities after this period, and we have to live long enough to make use of those opportunities. So we've issued a travel advisory today, which many of you would have gotten in your email addresses already, going into a bit of detail why it's better to avoid travel, locally, but critically internationally, unless you absolutely have to. On the NYSC stream today, the first stream of the second batch of NYSC for the year has just concluded and are leaving camp, and we're preparing immediately for the next stream, given the 3 streams that we have arranged. This has been a fairly successful operation, and we thank all the colleagues in PTF, NYSC, the state governments that have worked really collaboratively to make this work. Later today, we'll be having a meeting to review our progress so far and ensure that we take the lessons learned from this into the next stream that will be starting on the 3rd of December. So we continue to work with our colleagues at NYSC and all the states to ensure that all the positive cases that had to be excluded from the first stream are now admitted into the second stream. So that's exactly what happened. If you are tested positive, we tested everyone before coming in. So all of those that were excluded because they unfortunately tested positive will now be admitted into the second stream of NYSC. We encourage all participants, corpers, who are about to begin their year in service of the country to also be ambassadors and help us to sensitize others in the need to look out for each other. The next big operation we'll have will be with the Ministry of Youth and Sports as we work with them to ensure a safe delivery of the sports festival early next year. Preparations have started, just like the way we worked with NYSC, and again, we hope to work with them successfully, not only to deliver a good sporting engagement, but a safe one for the country. In addition to all of that, we continue responding to cases of yellow fever and Lassa in different states in the country. We are on the lookout for meningitis. This is the period of the year when these things start. So our work continues, never stops, as we work in trying to keep our country safe. So finally, the end of the year is always an opportunity to reflect on the year past and put in place necessary measures for the next year, learning valuable lessons. We are doing the same here. We're carrying out review meetings to look at what we did, how we did it, ensure that our work remains as successful as possible despite the constraints, preserving Nigerian lives and livelihoods during this difficult period. This is a task that we can achieve together with everyone taking responsibility as we keep pushing. Thank you very much.
The chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. So I think I'll stick to the same theme, which is really the issue of travel, particularly international travel at this time of the year. And I wanted to re-emphasize the process for Nigerians outside the country. Hopefully they will stay where they are. And for Nigerians in country, we will also stay where we are. But nevertheless, if people do need to come into the country, there are processes in place. International travel is no longer what it used to be, where you just take your box, buy a ticket, get a visa if you have to, and travel. It's a lot more complicated than that. We've tried to simplify things for traveling into Nigeria. As you are aware, for all travel, passengers must comply with the travel protocols and must use the Nigeria International Travel Portal. The PTF guidance on travel is very clear. Before you come into Nigeria from abroad, you must do a PCR test. The PCR test must be valid within 5 days of departure from your point of origin. Once you get your PCR test, COVID PCR test, and it's negative, you should go onto the Nigeria Travel Portal, which is https://nitp.gov.ng/. nitp.ncdc.gov.ng, NITP, standing for Nigeria International Travel Portal.ncdc.gov.ng. You register on the portal, you fill a health questionnaire, you upload your COVID-19 PCR test, and you go ahead and pay for the test in Nigeria, which will need to be done 7 days after arrival. On arrival in Nigeria, you must self-isolate for 7 days. And you then go ahead and have your test, and if it is negative, you exit self-isolation and continue with whatever brought you in country. There are certain aspects that remain mandatory. A, using the portal is mandatory. We will start enforcing it fairly soon. B, payment for the test is mandatory. C, 7-day isolation is mandatory. And after that, testing at day 7 is also mandatory. We have tried to make the testing at day 7 as easy as possible. For the Abuja portal, we have about 6 laboratories now, private laboratories. We are having an additional 2 coming on stream. And these laboratories also cover the rest of the country in the form of sample collection centers, except for Lagos. Lagos have their own set of 9 laboratories with their travel portal, which is linked to the national travel portal. Every state now has access to a molecular laboratory for testing. However, testing remains free if you have symptoms or if it is for public health purposes. For travel, you have to pay. This is in order for government to continue to be able to provide testing to those who need them for public health purposes. Those who do not follow the rules will definitely be sanctioned. We are already in the process of doing this. We know that on average we get about 1% positivity. So for every 1,000 passengers coming in, we get 10 positive cases of COVID-19. And considering the number of passengers we can potentially have per day when we open up our airports, which is up to 7,000 passengers a day, you can do the calculation and you would realize that there's no way government can just sit back and allow our skies to be open without some form of restriction in terms of testing and safety for our public. And therefore, what is the message? The message is there are processes in place if you are coming into Nigeria from abroad. There may also be processes in place if you are going out of Nigeria. However, please, for this period, if your travel is not essential, stay where you are. We are actively discouraging Nigerians abroad from coming home this Christmas because of COVID-19 and the amount of COVID-19 infections we have outside the country. There will be other holidays. 2020 was a different year, and there's no doubt December 2020 will be different as well. We will continue to monitor the figures from outside the country. But there's no doubt international travel is risky. And if we have a spike in cases or imports, we will take action, and there's a risk that you could end up being stranded, either outside the country or in Nigeria if you are coming from abroad. So the message is, if you do not want to get stranded, if you do not want to bring COVID to your elderly relatives in Nigeria, please stay where you are. There will be other holidays. Let us survive this one first. Thank you.
protocols, following of guidelines, working with the parent, the student, and teachers to make sure we have a H-free reopening and also a H-free learning environment. Well, I'm pleased to mention that the exercise is going on so far so good. There's cooperation from every angle. There is no any noticeable or measurable incident of any spread of infection. Everybody seems to be heeding the warning. So this is something that we feel we should also replicate in many other places. The balance of my briefing will be in Hausa because I don't need to repeat what the others have said. Jama'a Assalamu alaikum.
From Channels TV. My question is for the PTF National Coordinator. We know that load testing is a recurring issue among states. As a matter of fact, we identified 2 states that have met this expectation. Is there going to be a sanction for the other states? Because I think this is key for us to really see any results coming out from all this talking. Let's just know, just bring us up to speed with what's going to be done about this. And for the WHO, eventually vaccines will be here, maybe in about a year, like the chairman said. How is Nigeria taking baby steps in order to help us purchase this in terms of water supply and other infrastructure that would need towards this? Thank you.
I think the SGF or perhaps the Minister of Health could answer these questions. I want to find out, sir. We know clearly that the states are the ones who clearly have a lot of job to do, particularly as we approach the Christmas and New Year season. This message of ensuring that the cut down rate of transmission in the states, because for many of us, we see what happens in some of these states in the past few months. Gatherings are taking place and less or no attention are being paid to these non-pharmaceutical guidelines that we are talking about. I want to know, how do you hope to drive this message to the states to ensure that they adhere by these guidelines as we approach the Christmas and New Year season? Thank you very much.
We'll take the national coordinator, the WHO, and the chairman of PTF to look into those questions. So, and health, of course, yes. So let me now invite the national coordinator, Dr. Liu, to fire.
With the load testing and whether there should be sanction for states. So we continue to work very closely with the state governments. There's no doubt that the engagement needs to be more robust, and we need an understanding. We have given them funds, and we've made it very clear. We've corresponded twice with them on this issue. Some state governments are doing much better than others. So for instance, FCT now have tested more than 2% of their population. Lagos is well above 1%. Plateau, Gombe, and Rivers are approaching 1%. We are setting up a project working with NCDC, which hopefully would at least we would have a trial period before Christmas, but we are proposing to do 450 tests minimum in each local government area in the country for a period of 2 weeks. This will push most of the states into the 1% mark. The 450 tests will be taken in facilities based on the current criteria in terms of testing, i.e. looking at persons who have symptoms or presentations that might be consistent with COVID. That way we would push the positivity rate, because we are more interested in testing and finding positives than testing thousands and not having any. Secondly, we will be working, this project will be part funded by the state governments using the money that we've already given them, because part of the money we've given them is supposed to be for improving testing and setting up of sample collection centers. So we're doing the thinking, for them. If they are unable to spend the money, we will come to them and suggest what they can spend the money on to enable us get our target. So in other words, we're now being more proactive. At the same time, NCDC have worked on the rapid test kits. We're awaiting the validation results. We hope that the outcome will be very positive. I'm very certain that we will start rolling out rapid test kits in January. And this will involve providing the test kits to our hospitals, particularly our emergency units, for people presenting with symptoms consistent with COVID, and also to secondary school and university clinics, and enclosed communities such as prison clinics, etc. That way, you do not need to have a PCR molecular laboratory in order to do a test for COVID, and you can get a result within 15 minutes. That would push the number of tests we do in country substantially. The 450 tests per local government area will give us about 350,000 tests within a 2-week period. So that will push us to more than 1 million tests in country. If we distribute the rapid test kits as well, we would have additional thousands coming in. And already with NYSC, we've tested well over 35,000 NYSC corpus using the rapid test kit. And these results have not gone into the national system yet. So overall, in the coming weeks to early next year, we should see a significant improvement in our testing rates. Yes, it's still very low. Yes, we are not satisfied with the rate of testing. And yes, we need to continue pushing the states to do more. They've been given the resources, they just need to get on with it. With regards to vaccine infrastructure, I think the Honorable Minister of Health may be in a better position. But I know there's a lot of work going on behind the scene. The Honorable Minister of Health has appointed a ministerial expert advisory group on COVID-19 vaccine. The NPHCDA, Primary Healthcare Development Agency, has also been doing a lot of the technical background work in terms of the logistics, etc. And the PTF will be dedicating a whole session in the coming week at our meeting just to address the issue of COVID vaccine and how this can be funded and how this can be made available in country. So a lot of work going on. We are not resting on our oars. We know the risk of Nigeria not having access to the vaccine, because there's the potential in the future that countries will be labeled endemic for COVID-19 if they do not have a good vaccine strategy, and where the majority of the population remains non-immune to COVID. So watch this space, and we will keep you updated, hopefully after the PTF meeting next week, which will be dedicated to the COVID vaccine issue. Thank you.
The Honourable Minister of Health.
Thank you for the questions. The first one was directed about the states. There is a level of reduction in compliance and adherence that we have been complaining about in various parts of the country. But it is not only in our country, it is in some other countries. There are countries where there is very good compliance with all the rules. You put down the rules and they obey. If you look at foreign broadcasting stations, you see some countries where everybody outside has a mask on, they are all keeping distancing. There's a good amount of social discipline in some of those, in many countries. There are others where there is not just much discipline, and people who go out without masks, and they crowd up, and they don't obey any of the injunctions being offered by the authorities. There are, in fact, places where people they campaign against these measures. They do exactly the opposite. They campaign against it. They discourage people from wanting to wear masks. They don't wear, and they give all sorts of excuses for it, conspiracy theories about But in our own case, we know that these are measures that have been proven to work. And for those who do not have very strong systems, we must use all means within our reach. But we have seen countries that are very strong, whose health system is very strong, they are collapsing. We are hearing very high officials in very advanced countries saying that their health system is near collapse. They have got over 91,000 persons on admission for COVID. I don't see how we can manage that. We don't want to go that way. 91,000 and rising. So we need to err on the side of caution. And as I said many times, it's a sacrifice. Some people think that they can't breathe well. You can breathe. You can breathe well in a mask. And the mask should not be under your chin. Your chin is not what we are protecting. We're protecting your mouth and your nose. The nose should also be covered. For anybody who has ever done a COVID test, you know they take the first sample from your nose, from the back of your nose, and then from the pharynx. So you do have emissions from the nose. So nose and mouth should be covered exactly the way mine is. That's when you are safe, and that's when the person you are with is safe. Another common mistake is that people wear a mask, and when they want to talk to you, they remove it, which is exactly the opposite. Even if you are not wearing a mask, you want to talk to somebody, that's when you should go and put on a mask, because the mask is supposed to catch any droplets that come out from you, or any aerosol. So to take off the mask is actually counterintuitive, it's counterproductive, and it defeats the purpose. So leave your mask on when you are talking, especially in a group with a crowd of people. We will continue to engage the states, the authorities in the states. We discussed setting up a team that would pay visits to the states, spend a few days, serious advocacy to engage the team. So we are already looking for persons. We have already selected persons who can communicate well and can go to the states with a team to actually persuade the people to take this threat more seriously. We're also looking at the calling an emergency meeting of the National Council of Health to discuss it thoroughly with the commissioners and then sign a compact that we shall all, in the interest of our country, for the sake of our citizens, all do everything we can to comply with the rules and recommendations that are being brought out after scientific study. We know that it changes all the time, but as far as we know, we should obey the rules. Regarding the question that Sani deflected to me is about the vaccines. There are vaccines, about 4 that, about last count, or probably 5 in the meantime. They are coming out every time. There are several hundred that are being pursued, and a good handful that have done the clinical trial, phase 3, waiting for WHO pre-qualification. One of them has to be transported or stored at about minus 70 or minus 80 degrees. That requires ultra deep freezers, of which we don't have many in this country. And it will require procuring such deep freezers, which are expensive and they're not everywhere to be found. There's another vaccine that you can store or move around at minus 20. That one is more affordable. We do have, with our existing immunization system, freezers of that nature. So even if we have to buy some more, we will be able to use the ones we have here and add new ones to them. So we also hear that there are developments that will bring out vaccines that you can keep in refrigerators at 2 degrees or so, which again, that will be even more helpful because you find fridges everywhere, even solar-powered fridges everywhere, which will help us. It will help countries that are not so well resourced. So countries with very deep pockets can buy the minus 80 degree vaccines. I mean, storage, they can buy the minus 80 degrees freezers, and they can, for the vaccines that go with them, and because it's going to be additional expenses. So in buying the vaccine is just not the only step you need to take. You have to be able to have the wherewithal to store them, to transport them, to deliver them, and to dispose of the waste, and also manage the workers who are going to be doing this job. So there's quite expense that is involved, and that's why we are working with the group that was set up by the Gavi and WHO for access to the COVAX facility. We are in there. We are also setting up a group which we shall be reporting to the presidency to look at other ways of being able to get more vaccines from any other source that's accredited, so that we have options and we also have a latitude to cover any gaps that might pop up as we go along. These vaccines are still under tests and investigations, and we are observing very closely what they bring along. The Primary Healthcare Development Agency is the secretariat, and they have done a lot of groundwork already, studying all these, along with NCDC. They have done a lot of groundwork in studying all the options and the vaccines available on ground, and will be advising us as to what our options will be. And these options can change with time depending on new scientific discoveries that come up. Thank you.
Thank you very much, the Honorable Minister of Health. Now,
Thank you very much, the PTF Chair, Honorable Ministers, the National Coordinator for the PTF, the Director General of NCDC, members of the press, ladies and gentlemen. I just want to buttress the messages that have already been shared to point you to a document that WHO just released a week ago. And this document is an updated draft landscape on COVID-19 candidate vaccines. So it's now on the website, and it lists all the candidate vaccines globally and the stage at which each one of them is. And as indicated by the Honorable Minister of Health, indeed the WHO has already started to meet to look at those candidate vaccines that have reached a stage where they can be reviewed for purposes of being given emergency authorization for use. So that process has already started, and indeed it's within the context of the COVAX facility that the Honorable Minister has mentioned, which on one part will help to bring together all the vaccines that will be available and ready to be used, especially in this part of the world, but also is helping to make sure that countries that can make available donated vaccines are also available to countries. As of now, I can mention that the COVAX facility is looking at about 30% of the vaccines to be donated and the rest to be bought by the respective countries. But this may change depending on resources that are continuing to be mobilized. So that's the status of the vaccines. It is expected, of course, with the developments you have heard quite recently, that indeed the vaccines will become available on the market and countries will start to use. But I wanted to also just echo the message that the PTF chair gave, and also the national coordinator, that the interventions we have, the non-pharmaceutical interventions and others, they are the first vaccine that we have. The vaccine that is coming will not do magic if we don't partake in the first vaccine. So it is important that in as much as we await the pharmaceutical vaccine, let's continue to spread the message for people to abide by the measures that the PTF has put in place, the non-pharmaceutical measures. They'll go very well with the vaccine that is going to come. Thanks so much.
thank you.
Questions have been answered. Yeah, we're looking forward to having the vaccines as they get certification for being used. But I'm mindful to remind all of us that vaccines are no use to us unless the vaccination process takes place. And that is a major challenge. Even with the developed economies, what they are busy trying to do now is to ensure that they set up an infrastructure for the vaccination itself to take place, because vaccines would not be of any use to us if we do not vaccinate the people. And there is a lot of work that we have to do in that regard. And I believe the Honorable Minister of Health and the team at some of the agencies that have been very endowed over the years with the processes of vaccination, like the Primary Healthcare Development Agency and other sister organizations, will be putting infrastructure in place to ensure that when we finally are able to access the vaccines and procure them for use, they will be able to speedily determine who are those that will benefit from the vaccines, because the vaccines will not be available for everybody at the same time. And that is another danger that is posed. And that underpins the emphasis I've always made. Therefore now, your only vaccine is to adhere to the non-pharmaceutical measures. That's the only thing that you have available that is free. That you don't have to wait for any time. Just adhere to the non-pharmaceutical measures. I get a little bit scary that of recent, in the past couple of weeks, our figures were relatively low. You hear of infections from very long distances, but in the last 1 week, very much around us, you hear of infections. It means that we are going back to something that we had thought we had gone past. And that's reflective of what is happening all over the world. Even countries in Southeast Asia that had suppressed tremendously surges and infections in their countries are beginning to see a remarkable increase on the numbers. And for that reason, they have deployed either selective lockdowns on cities and towns and regions. Even within the same country, you don't cross into a particular region without quarantining. So it's serious business. And obviously in Nigeria, we cannot afford another second round of any form of lockdown because of the adverse effect it has had on the psychic of our people, on our economy. We will try as much as possible to avoid those pitfalls. But we have a collective responsibility as a people to respond to this appeal of being very, very careful. If I ask in this hall now, since the last test that we all took voluntarily, how many of us have subjected ourselves to other tests? Very few hands, probably. Very few hands. So I want to appeal to you before you jump on the train or on the plane to go enjoy the Christmas festivities and New Year. Subject yourself, because you have been on the front line too. This is not the only press conference you cover. You interface with a lot of people in the course of your duties. So it behoves on you to take extra precaution.
Allah ya kiyaye za ta iya ƙara ci gaba da yaduwa. Yanzu gashi muna ji muna gani ƙasashen Turai suna sake komawa wannan dokan zaman gida ɗin domin tana ci gaba da yaduwa. A ƙasar America,
you become unnecessarily protective of yourself, because that tells you that, okay, I am now negative. What do I have to do to ensure that this result does not turn positive on a future test? So that helps you tremendously to be able to prepare. And I want to encourage you, if you talk to Chukwe, he will be able to organize that. I have taken several, and I continue to. As a matter of fact, there were things that I started at the beginning of the pandemic that I forgot, but this weekend I got involved with some little crowd here and there because I had to attend to one or two social events. You know what? I went back and started the processes of, what do you call it, making sure that I steamed myself again. I went back to read because I remember when this whole thing started, we were doing it virtually 2-3 times a day. Whenever you had an opportunity, you go and steam yourself. But a lot of us have discarded those basic things that we were using to ensure that we kept alive and active and responsive to the virus. My sincere appeal is that this is not the time to let down our guard. COVID-19 is still alive, is still raging, is still virulent, is still dangerous. And the 20% of our population that we have tried quite successfully to protect, we shouldn't expose them to further dangers. And we should just remain resolute and committed to the non-pharmaceutical interventions until when the vaccines show up and we are able to take through the process of vaccination, which is another ball game altogether. The politics of securing the vaccine is in itself a difficult policy. You require a lot of resources. There will be a lot of competition. Everybody wanting to get the vaccine over to their countries. And when you get them, the logistics, some of them are going to be kept under the temperature of -70. Well, if there are refrigerators that have those capacities, they are scarce. And the big boys will begin to corner all these things, buy over the franchise of the manufacturer, all sorts of things, because it's a dangerous situation in which the world has found itself. And there will be survival of the fittest in this desperate situation. So, gentlemen and ladies, my appeal, let's stay with what we have, for which we don't pay anything, the MPIs. Thank you, and have a good evening.
Thank you very much. The chairman of PTF.
The chairman, PTF, the honorable ministers here present, members of the PTF, gentlemen of the press, ladies and gentlemen, good evening. Yes, I want to thank the chairman for his closing remarks, a good word of advice that he has given to us. I just want to remind ourselves of a few words that have come out in the course of this session this evening. You've been told that the pandemic is still very much alive. It remains virulent and very dangerous. So what that simply means is that we try to keep safe. We're also reminded that if any journey is not too essential for you, please put it off, especially during this December time. And for foreign travelers, the possibility of being stranded is there. So if you don't want to be stranded, and if you don't want to spread the virus to your very loved ones, please remain where you are. Keep safe. We know the efforts being made in the area of the vaccine. Yes, very encouraging. But you are advised that before the vaccine comes, the most vibrant solution remains observing the non-pharmaceutical intervention to keep safe. So in that case, you are advised to maintain all known measures that have been put up for you to keep safe. You're also reminded that testing is free for those who have shown some symptoms, but not that free for travelers. So if you must travel, you must pay. And of course, you have to remain vigilant at all times. You have to remain disciplined and abide by all known pharmaceutical measures that you've been told about. So with all this, we have to conclude that we can manage this pandemic conveniently only and only if we get tested early enough. And of course, for those who test positive, present yourselves for treatment as early as possible. Without this, I want to thank everybody and wish you a very safe week ahead. Until we meet again next week, Monday, please remain safe. Thank you.
Let's answer that.